Okay, so if you're anything like us, you probably feel a bit swamped by all the health news flying around. It's tough sometimes to cut through the noise and figure out, what really matters for you. But what if you could get a clear path, some real insights, maybe a few surprising facts, and hopefully keep it interesting along the way? Today, we're doing just that. We're taking a deep dive into some major health headlines hitting California right now. Specifically, we're looking at these new COVID variants popping up and also this growing worry about valley fever. Our goal here is to unpack what's in our source material. It's a really detailed article from Stark Medical. We want to help you understand what's spreading, why it's sometimes so hard to pinpoint, and crucially, how healthcare is adapting to help keep you safe.
Yeah, and what's really fascinating, I think, is how these two things, a virus and a fungus, quite different really, they sort of highlight the same big challenges. Getting a fast diagnosis, getting the right care easily, especially when the symptoms can look so similar at first glance.
Okay, let's unpack that. So California is dealing with this kind of dual threat right now. First up, that new COVID-19 variant making waves. The official name is NB.1.8.1.
Right, but people probably know it better by its nicknames.
Exactly. You might have heard Nimbus, or the one that really sticks, razor blade throat.
Oof. Yeah, that tells you something.
It does. And the article makes clear it's not necessarily more severe overall than older strains. But that sore throat symptom, apparently it's intense. So intense it got that nickname. It really shows how even a quote-unquote mild variant can still knock you out.
Significant impact on daily life, definitely.
And it's spreading fast. Wastewater data, clinical tests, they showed positivity climbing. Went from about 1.1% back in March up to 2.8% in early June. Experts seem to think it'll follow those familiar seasonal patterns we've seen before.
Well, that razor blade throat description, it really does hammer the point home, doesn't it? And connecting it to the bigger picture, it's just another reminder, isn't it? These viral challenges, they keep changing, evolving. And even if a variant isn't medically worse, its contagiousness alone can disrupt everything and put a real strain on, public health resources. It's this constant adaptation game.
Right. But then there's the other challenge, and this one might be flying under the radar for a lot of people. Valley fever.
Ah, yes, coccidioidomycosis, the fungal one.
That's the one, caused by these tiny coccidioid spores in the soil. Mostly found in dry areas, southwestern U.S., including big parts of central and southern California. And it spreads when the dust gets kicked up, wind, farming, construction, even gardening, potentially.
So just breathing it in, basically.
Exactly. And the symptoms, this is key. Fatigue, cough, maybe trouble breathing, fever, chest pain. Sound familiar?
Very. Sounds like COVID. Sounds like the flu. Sounds like a lot of things.
Precisely. And that's why it often gets missed or misdiagnosed. And what's really alarming, according to the source, is this isn't just some minor thing anymore. Cases have quadrupled in California over the last decade.
Quadrupled. Wow. That's huge. A silent epidemic, almost.
Yeah, fueled by climate change, they think. Drought, dry soil, more dust storms. It all adds up. And the numbers for this year, 2025, are pretty stark. Between January and April, over 4,000 confirmed cases already.
Just in those 4 months.
Just in those 4 months. And that's a 25% increase compared to the same time last year. Directly linked, the article says, to the ongoing drought and all that dust.
So it's getting worse, and it's hard to spot.
Right. Now, a lot of cases are mild, thankfully. But for some people, older adults, pregnant women, anyone immunocompromised, it can get severe. Chronic, even. In the rare cases, it can actually spread beyond the lungs, to the brain, bones, skin. That's called disseminated coccidioidomycosis. Really serious stuff.
Okay, so that overlap in symptoms is a major hurdle. It raises a really practical question for you, the listener. If you've got that cough, the fever, the fatigue, could be a COVID, could be valley fever, could be flu, how do you figure out what it actually is and quickly?
That's the million-dollar question, isn't it? And our source digs into why getting that answer can be tough with the usual healthcare routes. It implies this kind of domino effect, If the diagnosis is slow or wrong, well, first you suffer longer. But also, you might get the wrong treatment, like antibiotics for a fungus or a virus.
Which doesn't help the infection and contributes to that huge problem of antimicrobial resistance.
Exactly. So when you feel sick, what happens? The article points out that traditional clinics, your regular doctor's office or urgent care, they face real challenges during outbreaks. For sure, they just get swamped. Trying to get an appointment might take days.
Right when you need help the most.
And then there's the waiting room itself, sitting there with other sick people. It's an inherent risk for spreading whatever's going around.
Cross-infection central.
Yeah. Plus, we keep coming back to this symptom overlap. Cough, fever, fatigue,
Mm.
recent COVID, valley fever, flu, or even these superbugs. The article mentions bacteria resistant to antibiotics. Without the right tests, quickly like a rapid COVID test or specific blood work for valley fever, maybe a PCR lab test, it's easy to get misdiagnosed or just have care delayed.
And those specialized tests aren't always right there on hand in a standard clinic setting, are they?
Not always immediately, no.
Yeah.
So it's clear the old ways struggle a bit with this new landscape, which leads us to, well, what's the alternative? What does this source suggest is a smarter way to handle this?
Yeah, if those are the problems, what's the solution presented?
Okay, so this is where it gets interesting. The source really highlights telehealth, calls it a powerful and smarter approach, especially for infectious outbreaks like these.
Telehealth. Okay, so how does that help specifically?
Well, first, the obvious one, safety. You stay home, no crowded waiting rooms. Clinicians assess you remotely. Much lower risk of spreading or catching something.
Makes sense. Physical distance built in.
Second, they talk about rapid triaging and testing guidance. So, on a video call, a provider can quickly assess your symptoms, your risk factors, and then guide you on the right next step. Maybe it's an at-home COVID test. Maybe they say go get a flu test. Or we need to order that valley fever blood work. Saves time, saves resources.
Directing traffic efficiently, basically?
Kind of, yeah. Third, access. Especially maybe if you're in an area with fewer doctors. Telehealth can connect you fast, even to specialists if needed. That speed is crucial for something like severe bacterial infections or, again, valley fever, potentially keeping you out of the ER or hospital.
So faster access to the right level of care.
Fourth, and this ties back to what we said earlier, better antimicrobial stewardship. Telemedicine, when done right following CDC guidelines, is actually effective at reducing unnecessary antibiotic prescriptions, only giving them when truly needed.
That's a big public health one right there.
Definitely. Fifth, just the practical side in California. The state has strong telehealth policies. About half of adults here use it each year, apparently. And rules are in place to make sure you can access it and it's covered.
So it's widely available and used.
Seems so. And finally, it's not just for that first call. Telehealth is good for ongoing monitoring, too. Check-ins, tracking symptoms, making sure you're taking meds correctly. All without dragging yourself back to the clinic every time.
So it's more than just convenience then. It's really positioned as a key part of public health resilience, especially somewhere like California with diverse geography and access challenges.
Exactly. But that's the general idea. How does it work in practice, maybe with a specific provider?
Right, like the source article focuses on Stark Medical. How do they actually deliver on these telehealth promises? And, are there times when telehealth isn't the right first step? How does this empower you, the patient?
Good questions. And yeah, the source is clear. Telehealth is for smart triaging. It's not meant to replace emergency care. If it's an emergency, you still call 911 or go to the ER. Absolutely. But for those confusing early symptoms, that razor blade throat, that cough that won't quit, telehealth is positioned as that ideal first step. And Stark Medical, according to the article, is set up to make that work really well for the patient. They offer same-day video consults every day. So if you wake up feeling awful, you can likely talk to someone that same day. Crucial for catching things early.
Immediate access, okay.
Then that responsible prescribing piece. They specifically mention following CDC stewardship protocols, antibiotics, antivirals, only when clinically needed to fight resistance, fight those superbugs.
Stewardship is built in. Good.
They also handle the logistics. If you do need tests, rapid antigen, PCR, valley fever blood work, they direct you to a nearby lab. Then they track the results and loop it all back into your care plan. Seamless coordination is the idea.
So they manage the testing process for you.
Yeah, and then the follow-up. Video check-ins, medication reminders, symptom tracking. They support the whole recovery remotely. Saves you unnecessary trips. Plus, accessibility. Doesn't matter where you are in California, the platform provides secure access to their clinicians. Avoids travel, reduces exposure risk, gets you expert advice even if local clinics are packed.
Removes geographic barriers.
And the clinicians themselves.
Oh.
Board certified, experienced with these kinds of contagious illnesses, so they can evaluate that sore throat, recommend the right test, prescribe meds if needed, or order the right labs. Personalized care delivered remotely.
That really does sound like a complete loop from symptom onset through testing, treatment, and recovery monitoring, all integrated. So boiling it down, what are the practical takeaways? What should you, the listener, actually do to navigate this proactively?
Okay, so let's bring it home. What does this all mean for you? The source lays out some really clear, actionable steps, a smart approach. First, know your risks. Just be aware that multiple things are circulating. COVID variants like NB.1.8.1, valley fever, flu, even mentions of bird flu. Just have that awareness.
Situational awareness, basically.
Right. Second, act fast.
Yeah.
Don't wait and see for too long. First sign of symptoms, fever, cough, that bad sore throat, weird fatigue schedule, a telehealth consult. Early action is key.
Get advice quickly. Don't delay.
Third, test thoughtfully. Use at-home tests if appropriate, sure, but let the telehealth team guide you. They can help figure out which test you need and what the results mean.
Smart testing, not just random testing.
Exactly. And finally, stick to the plan. If they prescribe antivirals or have you monitoring symptoms, follow through. They're ensuring you're on the right track.
Treatment adherence. Makes sense.
Ultimately, the message is that these telehealth services, like Stark Medical's, are designed to give you that immediate access, expert evaluation, integrated testing, and evidence-based treatment. It's about helping you stay ahead of the curve. And remember, they serve all California residents via telehealth.
It really does underscore that shift, doesn't it? Moving away from just reacting when you're really sick, towards a model that empowers you with tools to respond quickly, safely, using technology to build resilience. It redefines proactive health in a way.
So wrapping up, we've looked at how this new COVID variant, NB.1.8.1, and this serious surge in valley fever are creating real diagnostic challenges because their symptoms overlap. And we've seen how telehealth platforms, especially the comprehensive approach described by Stark Medical, are emerging as a really vital tool, offering timely, safe, efficient care and crucial expert guidance for Californians.
It's a compelling picture of how healthcare delivery is adapting. And it leaves me with a final thought, really. As we learn more about how our environment affects our health, and as new infectious threats inevitably pop up, how might this kind of agile, tech-enabled primary care fundamentally reshape our health strategies for the long haul, for decades to come?
Something to definitely think about. Remember, the more you know, the better prepared you are to handle whatever health challenges come your way. Keep diving deep into the knowledge that empowers you.